is the Now Morning Show, and as Trinidad and Tobago confirms its very first case of the COVID-19 variant, which was revealed itself first in the United Kingdom, we have on the line via Zoom Dr. Erica Wheeler, WHO PAHO representative for Trinidad and Tobago and the Dutch Kingdom Islands. Good morning, Dr. Wheeler.
Good morning, Lisa, and how are you today?
I am doing well. Clearly, we color coordinated in our minds.
Yes,
This
yes,
morning. Dr. Wheeler, tell us, what do we know about this variant of the COVID-19 virus?
You mean here in Trinidad and Tobago or in general?
In general, and then we will talk about what it means for Trinidad and Tobago, the fact that we have our first case.
Right. So this variant arose back in September, at least it was identified in September, in the south and southeast part of the UK. At that time, it was just over 1,000 persons who were identified as having this new variant of the virus. There are others, and it is not unusual that viruses mutate over time. This is quite normal. H1N1 is a good example. Every year we get the flu vaccine. It is adjusted a bit because it has changed over the previous year. So mutations are not anything to panic about, but clearly in this case, what has been discovered since September is that this variant of the virus is more transmissible. So it has led to a significant increase in the number of cases in the United Kingdom. And it has now been found in different parts of the world, including in the USA, where it is expected to become the dominant virus, a variant of the virus by March.
Okay. So it is expected that it will, because of the fact that it spreads more quickly than the previous one, we should anticipate that the numbers should go up in Trinidad and Tobago?
Well, okay, so let's stick a pin in it right there. The individual who was found to be infected with this variant of the virus, we need to look at this carefully. So this individual came in as, well, I am thinking it's a repatriated person, but the main issue is the University of Trinidad and Tobago, the Faculty of Medical Sciences, now has the capacity to do the genome sequencing of the virus. Mm-hmm. So this individual, because they came from the UK and there is a policy in place by the government that all persons coming from the UK, once they come in, they would be put in state quarantine and isolated. So they're on their own. So when they came with their negative PCR tests and they became positive, it was identified as being the variant of the virus, they were already isolated. So this person was then transported to the hospital. So there's no opportunity for that individual to infect others, because there is an alert and a policy for 14 days quarantine for persons coming from the UK and the testing of the samples at UE.
So in other words, no need to panic.
Not an issue.
Yeah, yes. Yeah. What about the symptoms? Are they different in any way from what we know at present?
Well, no, the symptoms are the same. I think the issue is the viral load, the amount of virus in the upper respiratory tract is it's more than the regular COVID-19 virus, so that's why it is more transmissible. But in terms of the symptoms, no, there is no difference in the symptoms, and there certainly hasn't found to be a higher rate of mortality at this point. As I said, it was detected in September, where in January, almost a tip into February, but there is no scientific evidence that it causes more death or illness, but it does spread more quickly.
Okay, so what would be your recommendations now to the public, the people of Trinidad and Tobago?
Well, you see, we have to continue to do what we have always been doing. We have to continue to observe the public health measures. Under the current policy of the government, persons coming from the UK will not be, persons in the population will not be exposed to them. So there is no need to be concerned that those persons coming from the UK, if they have the virus, they could automatically spread it.
Yeah.
So that is contained. But we still have a responsibility to protect ourselves, because remember, we haven't started getting vaccinated yet. But even when we do, up to the 20%, that does not confer herd immunity. So we still have to continue to observe all of the public health measures that the government has put in place. It is the only way, and it continues to be the only way of protecting ourselves and, very importantly, protecting others from contracting COVID-19.
Dr. Wheeler, you know, the virus mutated in the UK. That's why we're talking about it as the UK variant. Is it that it can mutate anywhere? In other words, can it present itself in any other country, Trinidad and Tobago, for example?
Yes, if given the opportunity. So there are different variants of the virus. There, you probably would have heard South Africa as well, Japan. We know that in Denmark, there was a new variant in the mink population, but the minks were culled and that was taken care of. So that has died down. So you can see that there are variants in other countries as well. So they are tracked through genome sequencing. So the one in the UK is not the same as the one in South Africa, and it's not the same as the one in Japan. But the issue is, as long as persons mingle without protecting themselves, we give the virus, excuse me, a better opportunity of multiplying. You know, that's why this one is highly transmissible and it is spreading faster. So it is our behavior as human beings that we are the host, and we are giving the virus the opportunity to mutate and spread. So in order to suppress it as much as possible, we do have to observe the public health measures. We have to continue and not be complacent and not give up.
Is the quarantine time and the treatment time the same in terms of the 2 weeks, the 14 days, and so on for this variant?
Yes, so that's why the government had a slight change in policy for persons who are not coming from the UK, which is you can have, for example, 7 days in state quarantine and 7 days in home quarantine.
Right.
But with the new variant, you have to be in state quarantine. You don't have a choice. So some of the rules, as we learn more about COVID-19, we know roughly the period of time when the viral load, which means the amount of virus in the upper respiratory system, can be transmitted more easily in those first few days. So it means that even though you may have a negative PCR test on arrival, there is no guarantee that you won't then show symptoms within 2 or 3 days after. And this is something that we understand much more now.
Okay. Well, we're going to have to leave it there, Dr. Wheeler, but of course we'll continue to check in with you as we monitor the situation with this new variant, this new case, this first case in Trinidad and Tobago. That was Dr. Erica Wheeler, WHO PAHO representative for Trinidad and Tobago and the Dutch Kingdom Islands.